Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
And I'm delighted to be joined by Helen Stokes-Lampard, the chair of the Royal College of GPs. Helen, on Saturday morning, you opened your newspapers to see what looked like a sort of message from the Prime Minister that she thought at least a huge chunk of the crisis in the NHS was all the fault of GPs like yourself. I mean, how did you feel? And you've obviously been talking to your colleagues. How do they feel?
Well, I was absolutely horrified. I was dismayed, I felt undermined, and the messages coming to me from all around the country from GPs were that they were really demoralised and shocked by this, what felt like a terrible attack. Now, clearly it's not necessarily what the Prime Minister said, but the extrapolation of what she said that has caused all the distress.
And you hadn't really had any preparation for this idea that Downing Street was building a policy that you've got to be open 7 days a week and 8 till 8, had you? I mean, it sort of came out of nowhere, didn't it?
Well, the concept of working 7-7, 8 till 8 has been around for a long time, and indeed there are many surgeries around the country that already offer these extended hours of access for patients.
But as formal government policy...
It's in the plans called the GP Forward View, which are being implemented by 2020, that all patients by then should have some access. It doesn't mean to their own GP, it doesn't mean in their own surgery. Yeah,
and so it doesn't mean, let's be clear, 7 day a week, 8 till 8, all GP practices.
Absolutely, that's absolutely the clear message. And this only applies to England, it doesn't apply to Scotland, Wales and Northern Ireland either. But of course what happened yesterday was that suddenly all GPs heard the message that they personally had to do a 7-day week without break, and an unremitting workload just isn't safe. I mean, anybody would agree with that. So it was very distressing, lots of upset people yesterday. And so trying to disentangle the truth from the hype has been a real challenge. And
what do you think the truth is? Has anybody in the Department of Health taken the trouble to sort of ring you up and, because you've got this position within the profession where you are essentially the communicator of what's going on. Has anybody from the Department of Health yet been in touch to explain what's going on?
Well, people from the Department of Health are constantly in touch with the Royal College of GPs and other major organisations to clarify what the underlying true position is.
So what is the underlying true position? Can you help us?
Yeah, the underlying position apparently in England is that the pledges of the GP Forward View will be maintained, i.e. that patients will have access to GPs 7 days a week, 8 till 8 by 2020, not before that.
Right. And what about the suggestion, though, that you've all got to be available?
Well, that's clearly preposterous. It's not possible. You know, there are many people who work part-time because they have other responsibilities or do other jobs. You know, being a GP, as well as seeing patients, which of course is our core function, there's also training, research, education, commissioning, doing the management and the running of the surgeries, the policy side of things, that all takes time. So it's completely preposterous to say every GP is going to do 7 days a week seeing patients. It just doesn't work that way.
That said, many of us have had the experience, and I've had the experience of ringing up a GP and saying, you know, I or a kid of mine has got a problem, they can't see you, and they tell you to go to A&E. And that has happened. It's happened to me, and it's happened to lots of people that I know. You know, one of the reasons the government says that A&Es are under pressure is because that happens too often. That shouldn't happen, should it?
You're right, it shouldn't happen, and it's a sad reflection of the situation we're in, where we've got an underfunded, under-resourced service. We haven't got enough GPs, we haven't got enough practice nurses, we haven't got an adequately funded social care or hospital system. Let's be clear, this is right across the service that we have a problem. Obviously, GPs are my priority. So when it happens, that is a reflection of a service that is cut to the bone. We've talked about cutting the fat from the system. We've gone long past cutting the fat. We're cutting the muscle. And if you cut the muscle, the system just won't stand up anymore. So we are at a serious crisis point. So
you would agree with the boss of the NHS in England, Simon Stevens, that actually when it comes to it, money has to be a part of the solution?
Absolutely. Unfortunately, money underpins everything that we do. You know, I'm in the health service because I care about patients. I want to be spending my time with patients, giving them the attention that they deserve, not worrying about the resources, not worrying because the room next door is empty because we can't recruit another GP to join us. So, yes, money underpins it, forward planning, thinking, and all working together, joining up social care and the NHS more closely, recognising the demand, and I think it's time for some serious conversations from this country as to how much we want to spend of our GDP on healthcare.
But just to be clear, this is not about what GPs are paid. Many people would say GPs are well paid.
That's a distraction. That's an old-fashioned nonsense that came out about 12 years ago about some hype about some GPs that were excessively paid. It's just any person who wants to can just Google their own GP surgery and see the average salary in their surgery. It's out there, it's in the public domain. That's an old story, and it's a distraction from the real problems that we're dealing with, which are the NHS is valued by the people, it needs to be paid for.
Helen Stokes-Lampard, many thanks.
The Doctors' Union, the British Medical Association, has said the government is scapegoating GPs in England for the pressure on A&E departments. The government said GP surgeries must try harder to stay open from 8 a.m. to 8 p.m. or they could lose funding. The pressure on A&E services in recent weeks has been intense. It emerged this week that 65 of the 152 health trusts in England had issued operational pressure alerts in the first week of this year, at either level 3, meaning major pressures, or level 4, indicating an inability to deliver comprehensive care. On Monday, Health Secretary Jeremy Hunt told the Commons that the number of people using A&E had increased by 9 million since the turn of the millennium, but that 30% of those visits were unnecessary. He said that the situation at a number of trusts was extremely fragile. On Tuesday, the Royal College of Physicians wrote to the Prime Minister saying the health service was being paralysed by spiralling demand and urging greater investment. On Wednesday, the Chief Executive of NHS England, Simon Stevens, told a select committee that NHS funding will be highly constrained, and from 2018, real-term spending per person would fall. The Prime Minister described the Red Cross's claim that A&E was facing a humanitarian crisis as irresponsible and overblown. And the National Audit Office issued a report that found almost half, 46%, of GP surgeries closed at some point during core hours. Yesterday, Mrs May signalled her support for doctors' surgeries, opening from 8 a.m. to 8 p.m. every day of the week, in order to divert patients away from A&E. Well, to discuss this, I'm joined now by the Conservative MP, Maria Caulfield. She was an NHS nurse in a former life, and Claire Gerada, former chair of the Royal College of GPs. Welcome to you both. So, Maria Caulfield, what the government is saying, Downing Street in effect, is saying is that GPs don't work hard enough, and that's the reason why A&E is under such pressure.
No, I don't think that's the message at all. I think that's the message that the media have taken up, but that's not really? the expression that we want to give. You know, I know as a nurse, I still work as a nurse, how hard doctors work both in hospitals and in GP practices. But when there is 30% of people turning up at A&E that are neither an accident or an emergency, we do need to look at alternatives.
So, but where's the GP's culpability in this?
Well, what we're saying is that if we know from patients that if they can't get access to their GP, they'll do one of three things. They'll either wait 2 or 3 weeks till they can get an appointment. They'll either forget about the problem altogether, and which is not good. We want patients to be getting investigations at early stages, or they will go to A&E, and that is a problem. OK, I'm still not quite sure of what the role of GPs play in this, but what's your broad response to that?
Good morning, Andrew. I think probably about 70% of the patients that I see shouldn't be seen by me, but she should be seen by hospital consultants. So I think actually if we start to look at it from the GP's eyes, not from the hospital eyes, because that's always what it is, I think we might get somewhere. Tomorrow morning, every practice in England will have about 1.5 GPs short. That's not even counting if there's traffic problems, sickness or whatever. We can't work any harder. I cannot physically, emotionally work any harder. We are open 12 hours a day. Most of us, I mean, I run practices that are open 365 days a year, 24 hours a day. So I don't understand this. There's one thing attacking me as a GP for not working hard enough, but there's another thing saying that GPs as a profession aren't doing what they should be doing.
Sure. So let me just interrupt you. The National Audit Office has come out with these figures showing almost half of the doctors' practices are not, some of them are, for some point of the week, are not open in core hours. That's where the implication comes, that they're not working hard enough. What do you say to that? I
don't recognise this in the NAO. I'm not being defensive. I just don't recognise it. There are some practices that run palliative care services. Practices have to close for home visits if they're single-handed. Some of us are working in care homes during the day. There's management things. So, and they may shut for an hour in the middle of the day to sort out some of the prescriptions and some of the admin. But my practice runs a number of practices across London. if we shot in our contractual hours, we would have NHS England coming down on us like a ton of bricks.
Because they keep that close an eye on.
They keep that close an eye.
Maria Caulfield, so therefore I'm struggling to understand, given the problems the NHS faces, particularly in our hospitals, what this has got to do with the solution.
Well, obviously there are GP practices that are working, you know, over and above their hours, but there are some GP practices, and we know from the National Audit Office that there's particular black spots in the country, that Waltham Forest, for example, there's surgeries there that are only offering appointments of 3 hours a week, and that's, you know, causing problems for patients. If they can't get to see a GP, they will go and use A&E. But no one is saying that this measure would solve the problems of A&E. It would address one small part of it.
But we shouldn't be starting this, as I keep saying, and please listen to this, from solving the problems of A&E. We should be starting this by solving the problems of our patients in their totality, and the best place that they should go, not from A&E. And this really upsets me that as a GP, I'm there to be a proxy A&E doctor. I'm a GP, a highly skilled doctor, looking after patients from cradle to grave across the physical, psychological and social. I am not an A&E doctor. It's not you, Maria. It's all of this.
Okay, let her come back in.
I don't disagree with that, and no one is saying that GPs aren't working hard enough.
Well, you just did, actually, that some of them aren't.
No, well, what I'm saying is that in some practices, what we need to see is it's not just GPs who work in GP services. There's advanced nurse practitioners, there's pharmacists, so it doesn't necessarily need to be that the GP has
I think advanced nurse practitioners are in short supply. Physician associates all go to hospital. We have no trainees, or very few junior doctors in general practice, unlike hospitals, which tend to be have some slack with their junior doctor community and their junior doctor workforce. This isn't an argument. This is about saying, let's stop looking at the national health system as a national hospital system. GPs tomorrow will see about 1.3 million patients. That is a lot of footfall, a lot of activity with no resources.
If you wanted the GPs to behave better in your terms, when you allocated more money to GPs, part of the reforms, because that's where it went, shouldn't you have tied it more closely to how you wanted them to operate?
And that's exactly what the Prime Minister is saying. There's extra funding that's being made available for GPs to extend hours, to extend services. And if certain GP practices can't do that, then the money will follow the patient to where they can. We have no
doctors to do it. It's like having... I was on a coach last week, and the coach driver stopped in the service station for an hour. And I said, why are they stopping? They're stopping for a rest. We cannot do it. Even if you gave us millions more money, and thankfully NHS England is recognising that we need a solution through the 5-year forward view. We haven't got the doctors to deliver this. So and
that would take a while to get them to, I assume.
And that's my point, and that's exactly why we need to be using all healthcare professionals, not just doctors.
Even if you got this right, would it make a difference to what many regard as the crisis in our hospitals?
Well, I think it would. If you look at patients, they just want to go to a service that will address their problems. In Scotland, for example, pharmacists have their own patient lists, and patients go and see their pharmacist first. And there's lots of conditions. So, for example, if you're on anticoagulants and you need your warfarin check, you don't necessarily need to see a doctor. A pharmacist can adequately manage that until and free up the doctors in other ways.
The Prime Minister has said that if things don't change, she's threatening to reduce funding to doctors who don't comply. Can you both agree? That is probably an empty threat. That's not going to happen.
I hope it's an empty threat. We're trying our best. People like me and my profession, the seniors in our profession, are really trying to pull morale up and get people into general practice, which is a wonderful profession, absolutely wonderful place to be. But slagging it off and telling us that we're lazy really doesn't help.
I don't think anyone is doing that.
Very well. We have run out of time, I'm afraid, but I am certain we will be back to this subject before this winter is out.
I've been getting away with it all